Welcome to Bringing Better Health to Life, a program brought to you by Conway Medical Center. My guest is from Coastal Orthopedics. Meet Dr. Erin Watson. And Erin happens to be a physiatrist, which is a little different word than you're used to hearing, and we'll find out what that is in just a moment. But first, I want to find out a little bit about you. Where are you from, and where did you go to school to be a physiatrist?
Well, I grew up in Florida. That's where my home was originally. And when I was in high school, my folks decided to move to the Carolinas, so I followed along. So I actually went to medical school in Greenville, North Carolina at East Carolina University, where I stayed on after medical school to do my residency in physical medicine and rehabilitation. And the other name for that is physiatry.
So as a rehabilitation specialist, exactly a physiatrist, or is there any difference between the two?
No, the name, it's one and the same.
Wow, so it's kind of just a new name for this. And when I hear that word, though, I think about being part counselor and part rehab, physical person.
It's a specialty that involves an entire team of professionals, physical therapists, social workers, rehab nurses, and physicians to restore quality of life to patients and restore function.
We'll talk a little bit more about who needs a physiatrist in a moment, but let's talk a little bit about Coastal Orthopedics, because everyone there has their specialty.
Yes, at Coastal Orthopedics, so we have 8 physicians currently. Dr. Stuart Haskin is our hand and upper extremity surgeon. We have Dr. Curtis Elliott, who specializes in sports medicine as well as total joint replacement of the knee. And we have most recently Dr. Peter Ramsey, who also is part of the joint replacement program for hip and knee replacement. And Ross Taylor is our foot and ankle specialist. Dr. Billy Mills is our spine surgeon, who I work with very closely, and the other physiatrist is Dr. Wilkins, Jeffrey Wilkins.
So Erin, how do you decide who needs a physiatrist? When they come into your practice, who decides?
Well, if a patient is evaluated either by their family physician in the community or by one of the other orthopedists at Coastal Orthopedics, and a patient has not reached their goals as far as function, from day-to-day living, either before or after surgery, or if they're having uncontrolled pain, and then that's when I can step in as a physiatrist to better help them.
I'm sure many times you all are working with the mental state of a patient as well as the physical. I'm sure many people who come into you are depressed because they're not doing the things they love to do.
Right. If someone was an avid golfer, for instance, or a fisherman before, and suddenly they can no longer do those hobbies or even getting back to work and have some financial stress, that can be somewhat depressing and affect a patient psychologically. And so I think in some ways I'm part counselor, but also treat depression and anxiety and sleep issues along with pain issues.
I'm also wondering if you ever have to work with patients who have become overly medicated, because over the years they've had such pain, they haven't done anything about it, they finally come to you and they're on all kinds of pain meds. That's
true as well, yes. I see patients who are under and as well as over medicated, and a lot of patients don't want to remain on narcotic medication or other types of medication, and so I work with them and usually will focus first on, again, function and trying to get them back to doing the types of things that they like to do, and focus on physical therapy and other drug interventions that will get them back to working and doing what they want to do.
I would think as a physiatrist then you have to go over and above being just a doctor, and you have to really become their best friend so that they confide in you and say what's really bothering them and try to help them get up and beyond the ailment.
I really treat it as a partnership, and if the patient isn't invested in their care, then sometimes I reach a wall. There's only so much that medications can do. A patient needs to, for instance, get back to exercising, good nutrition, and doing all the right things, working towards getting a better night's sleep, and also kind of complying with the regimen. But I enlist the patient in developing the treatment plan and always check in with them with how it's going.
They have to be a partner in it all.
They have to be a partner if they're going to get better. Yeah.
We're going to take a break here, but when we come back, we're going to talk about what is fluoroscopy, and we're also going to talk more about what Erin does at Coastal Orthopedics. Don't leave us. We'll be back.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
We've been talking with Dr. Erin Watson of Coastal Orthopedics, and she is a physiatrist. And let's just pretend that I am a patient and I've come in and I've had a degenerative disc issue, which is tough to say, for a long time, but it's now gotten worse and it's kept me from doing all kinds of things. How would a physiatrist interact with me?
Well, oftentimes patients who come in with chronic or acute back problems will be either referred to our orthopedic spine specialist, Dr. Billy Mills, or myself firsthand. And a lot of times when patients come to me, they will have first had an MRI and maybe been through a couple of more conservative treatments. But what I would do on our first encounter was talk to the patient about what they're feeling, what they're experiencing, where their pain is located, and of course first try to find out where their pain generator is. So taking a thorough history and then also looking at the imaging studies. And then if someone is having problems from a degenerated disc or arthritis in the back, would typically start off with the most conservative care, which would be trying anti-inflammatory medications and perhaps some physical therapy, and then would have the second follow-up visit from there.
So sometimes these patients come in, they haven't been working, and I'm told that you can sit them down, help figure out where they need to be, and maybe even help them with a workman's comp claim.
That's correct, that I probably see about 15% of the patients that I see have suffered a workman's compensation injury, including injuries to the neck or back. And you know, my goal is to keep patients functioning and working as much as possible through physical therapy, through medication management, as well as sometimes procedures like injections, and if they need surgical intervention, would refer them to Dr. Mills.
You mentioned the word before we started our interview, fluoroscopy. I'd never heard that word before, but you said you use it in your practice, so tell us about that.
Yes, it's an X-ray modality where you can see real-time X-ray of really anything, but it's used in orthopedic practice quite a lot because you can take a real-time X-ray while you're doing a procedure. It's used a lot in surgeries, but I use it primarily in interventional spine procedures in the office and have been doing that in the office for about a year.
So when you say real-time, you mean that you can see it as it's happening? You don't have to wait for it to be developed, so
No,
to
as I'm
speak?
doing the procedure, I can see the X-ray instantly.
Amazing, absolutely. You know, you're so young, and yet I bet even since you finished school, you've seen incredible changes in your field.
I have, absolutely. There are several different types of procedures that I've implemented in the practice and have taken extra courses and extra training in to help patients, particularly with chronic neck and back illness.
We have about a minute or so to go, Erin, and I just wondered, what advice would you give those who are watching if they're in pain? There are a lot of people who say to themselves, well, you know, I am 70 and I am getting older, or, you know, I know what I did. I injured my back, but, you know, it's going to get well. But it's changed their life, and they're getting depressed, and there's just no reason anymore to sit around and be in pain.
I would say to the patient, don't accept that. Don't accept, you know, just because I'm getting older, that means I have to give up golf or give up cooking dinner for my family or giving up taking long walks. You know, whatever you used to do, there's someone out there that is willing to work with you to help you get back there. So just keep trying.
And Coastal Orthopedics is just around the corner.
That's right.
Thank you so much,
Thank
Erin,
you.
for being with us.
Very
Thank you
nice
so
to
very
meet you.
much. And I learned what a physiatrist is all about.
There you go.